You're listening to the Talking Headways Podcast Network. This is Talking Headways, a weekly podcast about sustainable transportation and urban design. I'm Jeff Wood. This week we're joined by Billie Giles-Corti, Melanie Lowe, and Geoff Boeing to talk about their papers in the Lancet Global Health series on urban design, transport, and health. To chat about the importance of walkability to public health and why Sao Paulo Brazil connects policy and outcomes so well. Stay with us. Today's podcast is brought to you by our super generous Patreon supporters. Thanks for supporting each month. We really appreciate it. To join this merry band of zoning nerds and infrastructure wizards, go to patreon.com/theoverheadwire. $2 a month gets you some stickers and a handwritten note. $10 a month gets you one of our transportation scarves. Heavy knit bus or bike only, or lightweight bike only with fading checkerboard design. Sign up at patreon.com/theoverheadwire and I'll send one right along. You can also purchase the scarves at theoverheadwire.com. Get your fresh Elmo or fresh Kermit before winter arrives. Order now at theoverheadwire.com. Also, because we do a lot of episodes covering a lot of books, we've partnered with bookshop.org as an affiliate. This means that if you buy a book through the Overhead Wire shop on Bookshop, a small amount of that purchase goes to us. Now, we love when you order from your local bookstores, but if you want to support the authors we have on the show and help keep us interviewing them, that would be tremendous. All the books we've ever discussed on the show with the authors are now in the shop. That's bookshop.org/shop/theoverheadwire. That's bookshop.org/shop/theoverheadwire. And finally, check out the Overhead Wire Daily Newsletter, established in 2006. We were doing it way before anyone else thought it was cool. Join thousands of readers and sign up for a 2-week trial at theoverheadwire.com to check it out. That's a 2-week free trial at theoverheadwire.com. Melanie Lowe, Billie Giles-Corti, and Geoff Boeing, welcome to the Talking Headways podcast.
Thanks for having us.
Thank you.
Thanks for being here, and welcome back, Geoff, who was with us on episode 275 before the pandemic.
How the world has changed, huh?
It's crazy. I think it was March of 2020 that you were on. It's a little bit different these days, but we're glad to have everybody here. Before we get started, can you tell us all a little bit about yourselves? And we'll start with Melanie and Billie, and then we'll go with Geoff.
Yeah, sure. So I'm a research fellow in urban resilience and innovation at the Melbourne Centre for Cities at the University of Melbourne in Australia. And my work focuses on policy analysis, looking at how do we get policy to support the creation of healthy and sustainable and resilient cities. And in this series, I led the first paper in the series where we did the international policy study.
So I'm Billie Giles-Corti. I'm the director of the Healthy Livable Cities Lab at RMIT University. And for the last 25 years, I've been looking at the way cities affect health. So how can we design cities to make people healthy? So that's been the focus of my work. And in this particular series, I led the first series where we came up with a set of indicators that we thought were important that cities should be measuring, and then initiated a new series that would see if we could actually do that globally. And so it was a really exciting challenge.
I'm Geoff Boeing. I'm an assistant professor at the University of Southern California's Department of Urban Planning and Spatial Analysis. I'm also the director of USC's Urban Data Lab and a non-resident senior fellow at the Brookings Institution. Most of my research revolves around urban planning and data science, so using computation to try to understand cities, particularly in the context of transportation and housing.
So Melanie and Billie, I asked this to Geoff last time he was on the show, but I'm curious how you all got into cities and how you're interested in the relationship between public health and cities. Was it something that happened when you were younger, or is it something that evolved later on?
Well, perhaps I can go first because Melanie was my PhD student. So I started out a PhD. I went back in 1992, actually, 30 years ago. I went back to university. I'd been traveling the world and knew a lot about cities because I'd been traveling a lot. And I started looking at, really, the World Health Organization had put out a new policy, and it said it wanted to give guidance to member states about how they could promote health. And two of those guidelines were healthy public policy and creating supportive environments. Now, healthy public policy is not creating good health policy. It's actually seeing how all policy could be health promoting. And it was a really good idea. It came out in 1986, and it was, so very much hot off the press. I was starting back at university in 1992. And so I took on the challenge of saying, well, what does it actually mean? There wasn't much evidence around it. It was a good idea, but there wasn't much evidence around supportive environments or healthy public policy. And so I thought that would be a really interesting PhD topic. And that's how I started out in this field. And, when I look back now, of course, it was a very naive the way I approached it, but it was a very comprehensive PhD. I picked up, planning, recreational planning, because I didn't really understand the behavior I was trying to measure. I was trying to measure physical activity, and physical activity has lots of different domains. There's recreational physical activity is going to the gym, there's walking for transport. And so I started it that way. And in the end, realized through the PhD that you had to narrow down. And so I started to narrow down and become much more interested in focusing on transport and walking and transport cycling, and also recreational walking and cycling. So becoming much more specific about the built environment that would encourage a certain behaviour. And so it was a really circuitous route. And in the end, because I was interested in lots of different aspects of health, we've looked at mental health, we've looked at dog walking and the way the built environment affects dog walking and how that affects health. And we've looked at safety. So because I had lots of different PhD students, I gave them all a different outcome measure, but we all used geospatial data, which is where Geoff comes in. We all used the same geospatial data, but we all had different outcomes that we were interested in. And then along the way, of course, we realised that we need to change cities. And that's where Melanie's work came in. She started to do work on policy, which was her PhD. So I'll let her tell you about how she got into it.
Yeah, so I was actually a physiotherapist first, and working in a sort of clinical environment with patients who'd had a car accident and were undergoing rehabilitation. I was really interested in, so I suppose the causes of ill health, and was much more motivated to think about kind of prevention and populations as a whole, rather than working with individual patients who had already, got sick. So I went back and studied public health. And in my public health studies, I became really fascinated by that close relationship between human health and our environments that we live in. And in this time, cities are the predominant human habitat. They're where the majority of people live. And I was particularly, curious about the kind of intersect of a lot of the 21st century challenges, climate change, issues around environmental sustainability more generally, urban environments' contribution to that, and as well as its contribution to our health outcomes, and fundamentally driven by a desire to tackle inequities between different population groups and different areas in our cities. I met the fabulous Billie Giles-Corti at the end of those studies and started a PhD in the field of looking at how policy specifically can support the creation of healthy built environments. And, the rest is history. We've been working together with a team of others for a few years now on that program of work in Australia, initially as a focus, and then increasingly internationally.
Awesome. I wanted to have you all on because, there's this really great set of pieces that you all put together for the Lancet Global Health 2022 series on urban design. I'm curious, first off, for those who might not be familiar, what is the Lancet and why is it so important to the health discussion?
Well, the Lancet is a medical journal. It's centuries old. It's known well for being a very high impact medical journal. But when you look back to what it was trying to do, it was trying to bring science to change the world for the better. And that was part of its original mission. And with the new editor, Richard Horton, or not so new now, but the editor, Richard Horton, he wanted to go back to its original mission. And so when we published our first series in 2016, it was a departure. It was exciting to think that they would think about the built environment. They do a lot of things now. They do climate change commissions. They look at obesity. They really tackle the upstream determinants of health now, even though they still have obviously a very strong medical focus. We got on the cover of the Lancet. Our first series was in 2016. And honestly, just to give you a sense of it, it's like when you're a researcher, it's like being on the cover of the Rolling Stone. That's how good it feels, to be on the cover of the Lancet when you've got your own series. It was really big deal. And so, but for the Lancet to take it on is really important because it gives it the imprimatur when people in health look to know that something's been published in the Lancet. One, they know it's high quality. Two, they think it's important because the Lancet's picked it up. So I think for cities to be a focus for the Lancet, in this case, it's the Lancet Global Health. It's got another, different sorts of journals now. It's become so popular. The second series was published in the Lancet Global Health. readers should know that the medical field, the health field, see that this is a very important area, and it's high impact because it gets cited a lot. So it's terrific to think that the city's agenda is well and truly embedded now within the Lancet series of journals.
It's really great that the health community, as represented by the medical journal, the Lancet, they really increasingly understand what I was talking about, that kind of close relationship between people and where they live, including urban environments and cities. And I think the increasing focus of that in the health sector is really indicative of a growing understanding that if we're going to create a healthy population when most people live in cities, we need to actually tackle those environments. And so the Lancet Global Health were very supportive of this work that actually sets out how and what needs to change in our cities in order to address those kind of upstream causes of ill health for the majority of the world's population in urban areas.
So going back to 2015, 2016, when the first one came out, how was that kind of initiated, and what did that first set of pieces tell you about, what was coming next in 2022?
So the first series was really agenda setting. So I led the first paper. It was led out of University of Melbourne. I was there as well. And Mark Stevenson, who was a professor there, he'd been a road safety researcher, and he had a relationship. He'd probably published in the Lancet before in his own research. And so he approached them about doing a series on urban design, transport and health. He was breaking into the field. I was well established in the field. So he asked me if I would write the first paper on city planning and health and population health, a global challenge. And then he did one where he modelled what the impacts of city planning were. So if we were going to create more compact cities, what would be the health impacts of that, taking into account urban design, increasing density and street connectivity. And so he looked at, in particular, cycling, and he compared 6 cities globally and tried to estimate what that would be. And as Melanie said, what we've been focused on is that we can't change cities unless the research that we're doing gets translated into policy and practice. And so the final paper in the first series was saying, well, what does the evidence tell us about using evidence to inform practice, and how important is that? And what do we need to do to ensure that we, one, design research that will speak to policymakers and practitioners, and 2, what needs to happen in terms of using that evidence and what will be the impact of that. And so we had some case studies in it. So that was the first series. But in the very first paper that I led, we said that cities should be benchmarking and monitoring themselves. And we came up with we were pushed by the Lancet, actually. They wanted to say, well, what would be the metrics for doing that? So what would be the indicators? So that's why we came up with a set of indicators based around, in transport, we talk about the 5 Ds for urban design, transport and health, to encourage transport behaviour or active transport behaviour. And so we came up with the 8 Ds, 3 regional interventions and 5 urban design interventions that were needed to encourage people to be able to walk and cycle and to use public transport rather than drive. And so what we wanted to do in the second series was to say, well, it's all very well to say this, but is it possible to actually do that? We didn't know that that was possible because we proposed policy indicators. So we would need to do policy analysis in cities across the globe. And we would need to create spatial indicators to look at the distribution of interventions in cities. So how walkable neighbourhoods were, whether people had access to public open space. It's easy to say create indicators that are comparable, but is it possible to do that? And we wouldn't have been able to do this. You can tell by the research that we're doing, this is a very multidisciplinary activity. It requires a big team and it requires lots of different expertise. And that's what we set out to do. We went around to conferences globally and we said, please join us. Would you like to join us and be part of this study? And so we were able to recruit by going to international conferences, more than 80 collaborators from 25 cities in 19 countries and 6 continents. So really exciting to do that. But really what was key to that was someone who could understand the policy work, which Melanie very much did. So that was, it tied into work we'd done in Australia. So she was able to do that. We had been measuring in Australia these spatial indicators. And so my team contacted Geoff Boeing in California to say, would you be willing to play with us? Because he was doing some similar work in other parts of the world. So we started to form this incredible collaboration. And so what's amazing to me is that for over 4 years now, we've been meeting every month, our study executive, thinking about how we can do this study, and we've successfully published the Lancet series. But we've also got this group of collaborators who Melanie and Geoff can tell you about how we involve them, but we couldn't have done the study without them. It's been a truly global endeavour, and they were recruited through going to conferences and getting people excited about the possibility and telling them that one of our outcomes we were seeking was not only to do the study, but also to get a Lancet series out of this. So that's how the study came about.
So once you get the indicators, the 8 Ds, and you've added 3 more Ds to get to 11, what do you do with them? Like, what's the process for pulling in the data for, doing the research to connect health and urban form?
So I guess the first part of it is pulling in the data. For this project, we did the combination. So a lot of our data came from public open data sources. So things like OpenStreetMap to try to model transportation networks and pull publicly accessible amenity information. The global human settlements layer to understand boundaries and get some variables about urban areas, about population, economic productivity, and so forth. But then the other part of it, beyond just the public open data, was that we worked hands-on with our collaborators, both for validation of those data and also to fill in the gaps. So they would take a look at our data sources and tell us what we were missing or what administrative data sets they had available at that city that they could turn over to us to put into our workflow. And it was that combination that really unlocked this research. Too often, for lack of a better data source, people will turn to something like OpenStreetMap and just use it as the best available, but it has a lot of holes and gaps in it. And if you're doing this sort of armchair research from Los Angeles and you're studying cities in India and Vietnam and Belgium, it gets really hard to do that validation yourself. So the collaborators were key to all of this. And that was one of the novel contributions of this project, combining those two together to do that better ground truthing. So we brought in that open data. We worked with our collaborators to validate it, fill in the gaps, and then we put it through our open source computational workflow that we developed for the project. It's all available online now for other folks to repurpose and calculate indicators in their own cities. And once we had those indicators, Melanie on the policy side.
Yeah, so our policy indicators are really looking at the availability as well as the quality of policies across a broad range of sectors, covering those Ds that you've mentioned. And so what we did is we developed a questionnaire that basically asked for information on local policy frameworks related to urban design and transport systems, access to public transport, public open space, things like air quality controls in land use and transport planning, also whether there was health goals and actions in policy, as well as government investment in active modes of transport infrastructure. So we had this questionnaire, and then basically our collaborators across the 25 cities, they provided the policy information for us. So then we were able to know what policies were available in those cities, and also they gave us information about the content of those policies. And the great thing about that is that then centrally we could do some analysis where we looked at what's the quality of those policies. It's great that you have one, but is it a good one? And that assessment looked at, did the policy was it specific, and did it have a measurable policy target to help guide implementation and hold governments accountable to that implementation? And also, were the policies consistent with the best available evidence we have about planning for healthy cities, or in fact, were they contrary to those goals of creating healthy and sustainable cities? So we did that analysis centrally, and therefore we could look across the cities and we could compare and contrast which cities had more complete policy frameworks, which ones had higher quality policy frameworks across the cities.
We know that from our work that we've done in Australia, we've been doing this now for a long time, and we've really got to the stage where it's not a rehearsal. The world's changing and we need to contribute to that. And we need to try and get our research translated into policy and practice. So based on that experience, what we did was and we'd done this in Australia for multiple cities as well, we created a scorecard for each of the cities. So we didn't want to just have the research published in the Lancet, although that was very exciting. And we got our cover of the Lancet again. So we're, big thrill about that. So that's all very exciting. But that's not enough to change the world and to change cities for the better. So what we did was we created scorecards for each of the cities. And this was a fantastic piece of work done by Carl Higgs and my team and Melanie, working with Melanie. And so he's created automated scorecards that we can take this complex data that we've collected and put it into user-friendly format. But we did two things, a scorecard, which was like a little infographic, one pager. That was done by Deb Salvo's team then at the University of Washington. But what we also did was we created this report, a little mini report. And our idea was that each of the cities could have a local launch of the results with policymakers and practitioners in those cities. And so we've been working with them to help them to set up a local launch and to get the research discussed locally with their local policymakers to look at what can be done. So there's been a series of those throughout the world with our local collaborators initiating these talks and working with their policymakers either through advocacy or through doing a presentation and having a discussion to say, well, are we doing well? Are we not doing well? What can we do about it? Because we didn't want it just to sit on, our academic shelves and feel pleased with ourselves. We want it to be used. And the other things that we've done is we've created a global observatory where we've got all the scorecards are loaded up and they're available free of charge. People can just go onto there, look at the city of interest, and they register because we want to sort of collect to find out what sort of people are accessing the website. But they're all available free of charge. And we want to now expand that to the 1,000 City Challenge. We want 1,000 cities to come on board and to use our tools and to replicate it, because we've now got the tools that people can create comparable sets of indicators that we can compare lots of cities. But it wasn't just an academic exercise. It had the end in mind. We've designed everything to be policy relevant, things that policymakers are interested in. So I think that this was another innovation of the work we're trying to do, is to try and change policy and practice.
That's very true, Billie, very important. Also, I suppose an innovation of the series is also having the spatial indicators that Geoff was talking about alongside the policy indicators, because that creates a really complete picture for decision makers. So they can go, what are the strengths and limitations of our policies and how can we improve the actual decisions that we're making about our cities? And then also really target those inequities. So by, looking at the spatial indicators and mapping those and seeing areas where there's lower levels or disparities in access to things that are essential, like public open space, public transport, walkability, then you can actually go, okay, where do we need to prioritise interventions in our city? So I think it's having those two things side by side that really helps to create a complete picture to aid decision making. And then lastly, we had a paper in the series that explored what are the kind of minimum thresholds you need for some urban design and transport features in order to optimise walking and active living. And so that's really fundamental. So that if we say, well, your policy is not ambitious enough, well, we're starting to create the evidence about what would be the minimum requirements for provision of public transport or street connectivity in terms of urban design, what you actually need as a minimum to support or optimise the health of your population, with all of the co-benefits for physical activity, for reducing air pollution and greenhouse gas emissions. So I think it's that completeness of the work, and hence the fact that we needed a team of 80, to collaborate on that program.
So I think what's important about this is there's lots of indicator programs out there. The Economist Intelligence Unit does an indicator. It does a citywide indicator. It tells you about an overall, it's a qualitative measure anyway. It's not measured like we've measured. But I think what's important is that most indicators are, even the UN Sustainable Development Goals, are about the whole city. So what's the average access to public open space or to transport? Now that's important in some ways in terms of looking at inequities across countries and cities, but actually tells you nothing about the lived experience of people within those cities. And that's really what the strength of having the geospatial indicators are, which I think were really important because, as Melanie said, we can see now the spatial inequities in access to this amenity that's health promoting amenity that people need to live a healthy and sustainable life. We're able to show that where the strengths and weaknesses are within the cities, where the inequities are. And you can't get that from just having an overall citywide indicator. It doesn't tell you anything about the lived experience of people within those cities and where the inequities are. So I think that was another strength compared to other indicator programs that we've seen globally.
One of the things that you mentioned, Melanie, is ambition. And, how much of this is determined by ambition for these cities? It seems like a lot of the cities have, at least I got this feeling from reading the papers, was a lot of the cities that have policies there are just because maybe it looks good to have a health policy on the books rather than actually something that might actually accomplish something. So I like this idea that you're holding their feet to the fire with the indicators, because it seems like from the policy perspective, at least, some of these cities are saying a lot, but not actually doing things.
Yeah, so that's definitely what we found. There was some cities that were better or worse at that, but really across the 25 cities, there was a lack of those specific and measurable policy targets. So lots of aspirations stated, or sort of, policy rhetoric around creating healthy, sustainable, even equitable cities. But when you look at the detail, there wasn't that specificity to back it up. So you're kind of left with a lack of those measurable targets to guide implementation and hold governments accountable. And then we also looked at, is the contents actually consistent with what we know creates healthy built environments? And whilst the vast majority of policies broadly do support those goals, even if they're sort of just general aspirations rather than those targets that we need, we found that actually some policy statements and policy targets were actually contrary to what we know, and particularly around a lack of ambition. But particularly, we found some cities didn't have sufficiently ambitious targets for walking and cycling or public transport use. So you set the benchmark too low, and therefore, where's the drive for the sort of transformation we need of our urban environments to shift from car-centric cities to ones that, have sustainable and active transport systems? And I think also another area where there was a lack of ambition for some cities was in low housing density targets. We need adequate housing density to support nearby destinations and therefore walkability. And so that was an area with low ambition for some cities. So these are the things that need to be, I would say, urgently revised, particularly if you've got a target, a specific target that lacks that ambition. You're really setting the benchmark too low and potentially locking cities into the unsustainable and unhealthy urban systems, which are not going to help us address the health and sustainability challenges of this century.
I think I saw somewhere somebody wanted a 5% share for biking and walking, and that was like their ambition, and I kind of shrugged my shoulders at that.
Yeah, so in the US, we included Baltimore, Seattle, and Phoenix. They were our 3 US cities, and I think it was Baltimore that you're referring to that had a target by 2040 to have a 5% walking, cycling mode share to work. And, alone it sounds like it's pretty low, but particularly when we look at international comparisons, it really stands out. So a place like Unst in Denmark is an exemplar of cycling target. They had a target of something like 45% of trips to work being by bike, and within a shorter time frame. So do you see the huge gap in ambition between that city and Baltimore? And certainly we found that the Australasian cities and the US cities had the sort of most car-centric policy frameworks. And that's perhaps not a surprise. Geoff can talk more to this, but we also found that those cities, similarly, when you look at the built environment, that they had lowest levels of walkability.
Well, that's an interesting thing about walkability too, is like, why is walkability such an important factor in this whole discussion? And how does that connect to the outcomes in terms of health that you're looking for? Because it seems like reading through the papers that walkability was one of the key ideas that ties the health part of it to the transportation urban design part.
Well, there's one thing you can do for your health is to be physically active. It's really like the silver bullet. There's nothing you can do that's more health promoting. Even in the face of other risk factors, being physically active is really a fantastic thing that people can do just for their own health. And so we know that, and we know that walking is something that's popular. So more people do more walking than any other physical activity. So we might think, going to the gym is important. People don't need to go to the gym to get health benefit to be physically active. They just need to walk more. And it's, it sounds pretty obvious. If you live in a walkable environment, you're more likely to walk. So if you can walk to the local shops, and there's some characteristics of a walkable environment. So it's the key thing to a walkable environment that you've got local destinations. And so when you've got really low density, you don't have enough people to make those shop services and public transport viable. And so you have very few shops and services to walk to. And if you've got nowhere to walk to, people don't walk. And the other thing that we include in our walkability index is the connectivity of the street network, because if you live in an area where there's lots of cul-de-sacs, it's a very circuitous route to get anywhere. People just tend to drive. Whereas if you've got a very connected street network where you've got lots of different routes that you can take, so if there's a dog down there that you don't like, or there's some houses that you might like to look at, it's an interesting street network, well, then you can go and take lots of different routes. So street connectivity, levels of density, not because density is important in itself, but because it makes the destinations more viable. And it's really the destinations that are so critical, because if you don't have destinations, you won't walk. And then the other thing is, of course, is what's really important is to reduce the amount of traffic, because we don't measure traffic per se, although I think we should, because what we know for cardiovascular disease, that exposure to air pollution is really damaging to health. And in fact, now air pollution is the fourth leading cause of global mortality. Around 8 million people die every year because of exposure to air pollution from cars, and cars are one of the biggest contributors to that. So, these built environment measures are really important for chronic disease or cardiovascular health. We used to worry in cities around communicable diseases, infectious disease, but now what we worry about is the impact of cities on non-communicable diseases or chronic diseases, the major ones that are preventable and causing so much ill health and premature mortality.
I feel like this is why the indicators are so important. And that discussion you were having earlier about comparing city to city is not as relevant to a person who's walking in a neighborhood. And that's why the neighborhood indicators seem to be very important, at least to measure, because of this, this indicator of walking that tells you a lot about how people are able to get around, and also gives an indication of their potential health outcomes as well.
Well, it's harder to measure to get those. I mean, the built environment measures, even though I say this, are easier to get. Geoff may not agree that they're easy, certainly, but they're easy to get from every jurisdiction. These are an indicator of the healthiness of the likelihood of people walking and using alternatives to driving. So whether they've got the potential for an active and sustainable lifestyle is determined by these built environment measures. And to create the built environment measures, you need a positive policy environment, which is the indicators that Melanie's talked about. So what we've been trying to do here, we've got a framework which says that if we want to promote health downstream, we need to be addressing the upstream determinants, the causes of the causes. And to do that, that's the policy environment which determines what the interventions are, which are the built environment spatial measures that we've been measuring. So that's why we measure the upstream, because we think if you get these right, they are going to produce a better health outcomes downstream. But most people don't measure the upstream things. They tend to measure, well, what's the air quality like? Even in the UN Sustainable Development Goals, their framework, they measure what the quality is like. But to change the air quality, you need to change the policies upstream that will change the transportation behaviours that will produce better air quality downstream. So that's what we've been trying to do, is because we're focused on the determinants of health.
And when you talk about the neighborhood scale indicators, it's important to remember that's letting us do within city comparisons and analyses beyond just the normal between different cities. Within city is key, because that's how you start getting at questions of justice and equity within the jurisdiction of a single planning regime. You can say which populations have access to health promoting infrastructure and daily living needs within an easy walk, and which don't. And that's something that's a lot harder to tease out and reason with when you're just ranking cities against one another, rather than unmasking all that heterogeneity within individual cities.
I think the IPEN study, I think it was paper 2. This was what stood out to me. We estimated that population densities of at least 5,665 people per kilometer squared would be associated with a minimum of 80% probability of walking for transport and 6,491 people per kilometer squared would be associated with a minimum of 58% probability of accumulating at least 150 weekly minutes of total walking, which is the standard. So about 20 minutes, 21 minutes a day or so of walking is the standard for better health outcomes. And so this actually puts it together why the densities are so important for walkability and what that means, I think, overall for what you're trying to accomplish.
It's really critical, actually, because it's hard to do those sorts of studies. You really do need a very large sample. And so because IPAN, the International Physical Environment Network, they were a really big part of our study as well, because they'd already been doing this work in this area. But what's interesting about these thresholds is that they are global thresholds, but we'd actually estimated something similar in Australia. It's not that dense, actually. For density, it's around 25 dwellings per hectare, which you may not use in the US. Geoff, can you convert that to acres?
Unfortunately, I cannot.
No, you can't.
I 14,000 people per square kilometer is 56 people per acre. And that's the only one I translated because I was trying to translate them as I was reading throughout the whole thing. But that's the point where the negative relationship, if you get too dense, right? That's the math that I did. So 56 units an acre is where the upper limit is. And I'm guessing that 25 per hectare is probably, I don't know, 7 or 8 or 9 dwelling units per 9.
It's not very dense. I mean, I guess that's the thing, that's the take-home message here. We're not talking high density. We're talking modest density, where you've got a mixture of different types of housing. So some people might live in an apartment, but other people would live in a house. Other people might live in a townhouse. It's not very dense. And so I think that's the take home. And we also found, as you just pointed out, that there are upper thresholds that beyond which we start to see that walking will go down. So it's not like we're promoting that, every city should be really super dense, but we're even in the suburbs, and that's a key message here, we're arguing that we need to be stopping the urban sprawl that is so characteristic of Australian and Australasian and US cities, and to put in medium density, modest amounts of density that would actually ensure that people have access to shops and services. And the interesting thing for us in Australia, we've done lots of studies, and we find that around 2/3 of people would really prefer to live in a suburb where they could walk to shops and services. So I feel like there's a latent demand for this product, which we're not providing very much of.
Yeah, Geoff, in the American context, when we start talking about density, people get scared.
Right. Yeah, exactly.
All the political problems with planning start rearing their head. But as Billie was just saying, what we're finding correlationally here is that ideal levels of density for promoting physical activity aren't scary density. We're not talking about central Hong Kong. We're talking about the kinds of gentle, medium density cities that Americans love to go on vacation to, right? Like Paris and so forth. That obviously there's some kind of appeal to those kinds of places that I think we need to work harder as a profession to destigmatize in planning conversations at home.
That's interesting. Just every time I hear a dwelling units per acre, I just go back to Zupan and Pushkarev from 1977, which they published a book called Public Transportation and Land Use. And the lower threshold for density that was needed to support public transit was like 9 dwelling units per acre in the US context. So if those types of numbers are not very big when you think about density. And really 25 units per acre is the kind of standard that people talk about a lot here in the United States. But really, if you think about commuter rail or other things, 9 units an acre is doable. And I think that once you get to a certain spot, you start to have those corner stores and have those access to destinations and other things like that. And I think that's what makes the walkability so important. Here in my neighborhood in San Francisco, I can walk to the grocery store, I can walk down the street to get most things that I need. And actually, I don't have a car because of it. And so that makes it easy for me to do whatever I'm doing on a daily basis. But a lot of folks here in the US, and I imagine in Australia, don't have that opportunity because of the way that the built environment is. There's also an interesting part about this, which is not just density, but it's also, transit stops in the area. And there's also intersection density. How are all these other metrics tied in? I mean, we talk about density a lot because it's a hot topic, but there's also other indicators that kind of mix in different parts of people's transportation experience.
Well, connectivity is really important because what it means is if you live in an area where you've got really big blocks, you don't have much choice. It doesn't make a very connected street networks are really important because they provide people with alternative routes that they can take. And the more corner blocks you have, the shorter the distance between where you live and where you want to go, because you can almost do like almost a straight line. So that's why lot length is really important. I went to Brazil for a trip and I was horrified at the size of the blocks. of land, so huge, because if you wanted to walk around the block to just go around the corner to the other, the next street, it was a huge walk. And that's why connectivity is so important, because it actually reduces the distance that you have to travel to get to the destinations that you want to go to. So connectivity is really important. And of course, distance to transit is important, because the closer it is, the more convenient it is, provided that it's not going to go on a circuitous route. I mean, we don't measure the route or the quality of the service, or we do frequency of service, but we don't look at the directness of the route. But that's the reason why we put in distance to transit, is because if it's closer, it's more convenient, and particularly if there's a frequent service. So, I mean, these are all about making it really convenient. What we talk about in health, you want to make the healthy choice the easy choice. And that's what this built environment measures are about, is trying to make it easier for people to do it. And what we find is when people live in easier environments, which are more walkable, surprise, surprise, they walk. Even if they don't particularly like walking, they walk more, because usually in a walkable environment, it's less convenient for driving. And so what you find is that I live in Fitzroy in Melbourne, and, I would never drive to the supermarkets because it's inconvenient to drive. I just have my little old lady's granny trolley, and I just go down and take my trolley and go shopping, and it's convenient. So I'm really fortunate in having that, as you must be in San Francisco, where you can get everything you need, don't need to have a car. And it reduces the cost of living as well, because we've got cost of living crises all over the world. And if you live in an area where you don't need to drive, it really reduces the cost of living. It's much more convenient and it's cheaper.
I just got a wagon to pull to the store. It's also for the baby, but it also helps me go to the grocery store now, because I can put all the groceries in the wagon and bring them home without hurting my hands from the bags. You also mentioned Brazil, Billie, and it reminded me actually to ask you all about Sao Paulo, because it was given as a positive example of policy leading to outcomes. So I'm wondering what they're doing so well to have that actually work out for them.
Yeah, so on the policy side, we found, we only had a smaller sample of middle-income country cities. But in those cities from middle-income countries that we did include, we found that in general, they had more policy gaps and the greatest issues with the quality of their policy frameworks, with a sort of standout exception. So Sao Paulo in Brazil really was a leading light. In fact, its policy framework in terms of policy presence as well as policy quality outperformed many of the cities in high-income countries. And so this is terrific news that there's these examples internationally, of which Sao Paulo may be one, that other low and middle income country cities can actually look to, that it's not just the high income countries that have the capacity to develop those strong policy frameworks, but that can be regardless of levels of development. So it's a really important, I think, message. We certainly need to support policymaking capacity in lower resource settings, and that's a key role, I think, for multilateral international organisations, as well as the leadership of high-income countries, but that there are examples of really positive policy frameworks out there.
Finding those links between the spatial outcomes and the policy frameworks was one of the interesting things in this paper. And we use Sao Paulo as one of the examples for doing a good job policy-wise, and then seeing it very clearly in the urban form when we measured with the spatial indicators. And we contrasted that with Bangkok, that Melanie's team similarly found it had the greatest policy gaps and limitations in its implementation of policy. And we saw the exact same thing in the urban form again, where its accessibility and walkability were very limited to certain corridors with huge gaps in the middle of the city. So you really see the link between policy and the lived experience of people on the ground follows from it.
How do you all hope that this framework will be used? Like what happens if cities start adopting these measures, like they have NACTO guides, for example, here in the United States to better design streets? Like, is this a goal of yours to have, every city basically use the same indicators so they can be compared against each other and then try to get those health outcomes you're looking for?
I think that would be fantastic, but more so not so much the comparison between cities, but using the indicators to, firstly create stronger policies and fill those policy gaps, but also then commit to implementing those policies. So ensuring that, there's detailed implementation plans and that there's that follow through to deliver the urban design and transport features that people need to support healthy living in their cities. And then importantly, our ambition is also for those indicators to be used to track and monitor over time performance, so that it's possible to see, almost like an early warning system, whether there's unintended negative consequences, what's working, what needs to be changed in policy, as well as its implementation, to ensure that we actually move in that positive direction. To achieve the sorts of goals set out in the Sustainable Development Goals and international commitments around carbon emissions, we need to radically transform our cities. And so I just think indicators are part of that effort to ensure that we know what is currently happening in our cities, and then we can actually track and monitor change over time so we can work towards those desired endpoints.
Geoff mentioned that Sao Paulo was kind of surprising, and some of these connections were surprising. I wonder if there's anything else that surprised you all about the work that you all did.
I think that was a surprise that Sao Paulo came out. I mean, it showed to me that there are some things that we didn't measure, and we picked that up in our final paper where we said to where to next. I mean, the connectivity is really important, all the things that we found in Sao Paulo, but safety is a big issue there. So we didn't pick up like how safe it is. And so there's other things that we should measure in our cities that we should be picking up. And what we've done in the final paper is said that there are additional things. Originally, we were proposing the 8Ds, and now we've gone to the 11Ds, because we've brought in that we not only have to protect human health, we also need to protect ecosystem health and planetary health. And so our ambition has grown since our first series and doing this second series to say that we need to be putting additional indicators, tree canopy for heat island effect. We need to be putting in measures of, where people are building. Are we, because of climate change, are people building in disaster-prone areas, flood and fire risk areas? And safety is one of those things. We didn't have a measure of safety. It's very hard to measure that because it requires, data from police departments who provide crime data, but we weren't able to measure that. And I think that's something that surprised me, that someone like Sao Paulo came out so well, because the built form is right, and that's fantastic. But we didn't measure the crime there and people's fear of being mugged. And so that's something that surprised me. The other thing, like for Barcelona, for example, one of the big concerns there, it's got a great built form, but we didn't pick up traffic. And so one of the big problems in a city like Barcelona, it's got fantastic built form, but it also has a lot of traffic. So there's additional indicators that we need to include that will tell you something about the quality of life and the air quality in those cities. So there's much more work to be done, but that was a couple of things that surprised me.
I was just going to add to what Billie was saying about the things that are hard to measure, or perhaps even unmeasurable, unquantifiable aspects of cities. One key thing that we flagged for future work was measuring the quality of the pedestrian environment. So, beyond things like traffic and air quality, thinking about presence or absence of sidewalks, the quality of those sidewalks, how traversable and navigable is that pedestrian street system. It doesn't matter if you have amenities a couple hundred meters away, if taking your life into your own hands, just trying to get down the street. And that's something that it's always hard to measure. There are no good data anywhere really for this. OpenStreetMap has some community around digitizing sidewalks, which I think would be a huge boon. If we have more folks contributing to the open commons, it would allow us to better understand, measure, advocate for, intervene in those kind of environments.
What's been a really pleasant surprise is, like what Billie was saying, with the launch of our Global Observatory of Healthy and Sustainable Cities, just the levels of engagement and interest. We've been immersed in this work for years, and obviously we've had the interest and engagement of a high-profile journal like Lancet Global Health, but to see that uptake internationally, the launches in our cities that included in this study, the engagement of policymakers, people coming up to us who say, can I measure indicators for our city? That sort of momentum is really delightful, and I think suggests that we're on the right track here in terms of there is a lack of information that people need, and there's that real appetite to get that information in the hands of decision makers so they can make those policies and implement them for those health and sustainable city outcomes.
People want to advocate for better cities. No one's more motivated than the citizens suffering under bad local governance. And the more we can empower citizen scientists to play a role in keeping their governments accountable for healthy living, the better.
Where can folks find the papers if they want to get them or contact you or get in touch for maybe being a part of the next research project that you're looking at?
They're available free of charge for everyone to download, so they're freely accessible. So on the Lancet Global Health website on urban design, transport and health, but we'll put the link. And also people could have a look at the Global Observatory. So it's the Global Observatory of Healthy and Sustainable Cities. So again, the link can go on the website. And there's a lovely infographic that the Lancet Global Health did on their website, which will explain all that we did in a very succinct way, very user-friendly. And those who want to dig down and read the papers in detail, they're available for people to use as well. One of the things we'd like to do is to invite other cities to get involved. Whole cities we want to measure throughout the world. So there's the 1,000 City Challenge, and we'll have details of that on our website. So the Global Observatory of Healthy and Sustainable Cities, you can find there details about how you can register to become one of the 1,000 cities to be in our big challenge. And we'd really love people to come on board with that. It does require putting together a team, someone who's got some geospatial background, someone's got policy background, someone who's an advocate. There's a job for everyone. So we really want people to put teams together and even work with their city to create these indicators. And that's our big challenge now, is to try and make this an even bigger Lancet series in the future where we have our 1,000 cities rather than just our 25 cities. So that's what we're aiming for now. And that will be led by the next generation of gorgeous young things that are coming through, our collaborators who are really keen to take this to the next level. So it's very exciting. A study like this is really important. It couldn't be done without a huge team. And what we'd like to do is acknowledge the study executive who've overseen the study, but also the collaboration, the Healthy and Sustainable City Indicators collaboration, an enormous group of people who've put a lot of time into this, and really want to acknowledge and thank them for all the work that they've done. It's been a great team effort.
Awesome. I'll post everything in the show notes. We'll have it in the link in the article when it comes out as well. But if you want to go now, healthysustainablecities.org is the place to go. Billie and Melanie and Geoff, thank you for joining us. We really appreciate your time.
Thank you.
Thank you very much.
Thanks so much, Geoff.
And thanks for joining us. The Talking Headways podcast is a project of The Overhead Wire and published first at Streetsblog USA. Thanks to our wonderful Patreon supporters for sponsoring this week's show and Mondays at The Overhead Wire. Find us at patreon.com/TheOverheadWire. And you can sign up for our 16-year-old newsletter at theoverheadwire.com. And you can also listen to our show on your podcatcher of choice, including Spotify, Stitcher, SoundCloud, iHeartRadio, and Apple Podcasts. And if you can't find it there, you can always find its original home at usa.streetsblog.org. We'll see you next time at Talking Headways.